Hi, I'm Garni Barkhoudarian. I'm a neurosurgeon here at the St. John's Cancer Institute and Pacific Neuroscience Institute, and I function as the ombudsman for the Don Morton Fellowship in Surgical Oncology. I've been working with the Surgical Oncology Fellows for many years now, over 10 years at this point, and have had a number of great interactions with our fellows. As my role, as somewhat of a third-party individual, I'm here to help and facilitate any sort of challenges our fellows may have and to identify any structural problems within the fellowship that could be addressed and to help with the fellowship experience for our fellows. With regards to our clinical patient population, there's a tremendous amount of overlap, as one would expect, particularly within the melanoma patient population, where there's at least a 40% rate of brain metastases, many of whom need stereotactic radiosurgery, some of whom need open surgery. And as such, we interact a lot with our surgical oncology fellows and faculty in the care of these patients. In the past, we've had a number of clinical trials and retrospective studies looking at our melanoma patient population and how these patients have done surgically and medically as we treat them. I've collaborated closely with some of the surgical oncology fellows in these studies alongside our neurosurgical fellows.